because a calm body is so important. And when we want, as a co-survivor, if we want to be helpful for someone, what are some things we can do? Well, besides cooking, we can actually bring touch. And here are some free internet courses on simple things that we can do for our friends and family. Chair massage, gentle massage, breathing techniques. These are all, again, available for free. And as you experience it, then if you want to work with someone with a lot more experience in this, then you know exactly the questions and the resources you'd be looking for from that health professional. So think six symptom management, SX, symptom management messages. So number one, if you want to decrease stress, anxiety, agitation, then the approach is meditation, massage therapy, self-hypnosis. If you want to control pain, nausea and vomiting, stress, then the approach is acupuncture and mind-body therapies. To relieve constipation and get GI motility up and running, massage therapy is great. To restore salivation, what's called xerostomia, acupuncture. To improve range of motion, acupuncture. Restore function and enhance survival, fitness, nutrition, dietary supplements, and where appropriate, counseling. And it can include health coaching or it can include psychotherapy. So I'm hoping that we're going to get on these topics so we can talk about them a little bit more. But our goal is, again, how to be great survivors, how to be great co-survivors. And these really require courageous conversations. We all want to be helpful. We all want to be helpful. And this actually is a particular risk. But the risk is that we're not present. So I want to share an illustrative story regarding this. So, first day as a hospital chaplain. I'm 23, and I'm kind of full of myself. And I said, well, I've been a hospice volunteer. So first day of chaplaincy, I was assigned to a ward of 36 people. And in my second year at divinity school, I thought I was so ready. And I'm just like, hi, I'm Greg. I'm going to be the chaplain this year. Nice to meet you. And everyone said, oh, hi, nice to meet you, blah, blah, blah. See you around. Person after person after person. Until the very last person. A woman named Chris who had had a laryngectomy. She couldn't speak. She could only write. Said, hi, I'm Greg. Nice to meet you. I'll be the chaplain this year. I'm from Minnesota, or something like whatever I did at that time. And I expect her to write back to me, oh, hi, nice to meet you. See you around. But instead, she wrote back to me, I blame God for this. And you know, when you're stressed out, you regress a couple of developmental stages. So there I was, just like, I don't know what I said, but I said something along the lines of, I'm going to go to the library and I'm going to find you the answer. Oops. She never spoke to me, or never wrote to me again. I had blown it. What instead if I responded back? Tell me about this. Would that have opened up a conversation? Would that have opened up a relationship? A relationship where we can connect as fellow human beings rather than as an expert with answers or access to a library. It's a very, very different thing. But I've discovered that in our culture, we are all trained to be answer givers. And we can see it in kids as early as age 2 or second or third grade. And we certainly see it in adults after 26th grade. Have I got the answers for you? In fact, your answers ought to be my answers. It's like, no, no. So our challenge is to be the presence. And in order to be fully present to people, it's such an important gift we can give people. I love this from the psychologist Carl Rogers. The gentle and sensitive companionship of an empathic stance, again, listening with heart, provides illumination and healing. Deep understanding is, I believe, the most precious gift one can give to another. So as survivors and co-survivors, that's why I want to kind of emphasize in the time that I have for this is to talk about the key point for presence is to recognize and bracket our emotional needs. When we're faced with something painful, I blame God for this. The natural response is to try to fix it, or, oh, it's okay, you don't need to worry, or it's a very different thing to say, oh boy, my buttons are pushed, but I'm not responding to my discomfort, I want to respond to the person's discomfort. And that means really just saying a simple thing like, tell me about it. Opening up the thing. So questions I found really helpful, they're kind of nice to know about, or just kind of actually a response. Tell me about it, or can you tell me about it? Can you tell me further? What does this mean for you? Related things are, how can I be most helpful? And this is a very important nuance. It's very different than, how can I help you? How can I help you? How can I be helpful? Co-survivorship. And what's most important to you this hour, this week, this month, this year? What's most important to you? From those points, then good things will come. And I think that's where we can be present and helpful, rather than wanting to fall into the trap of having answers and trying to fix. So I want to just conclude with here with just one other thing. This is kind of a fun character. It has 3 elements to it. The first element means to lift up or rise up. The element right below that is back of the throat. And this is the character for sound, as in, say, ah. What happens? The back of the throat lifts up and there is sound. Now, if we add this character for sound to this metaphoric heart again, we turn to the heart theme, we have a new character. This is meaning. Meaning is sounds of the heart. When we hear things which are meaningful, they are coming from the heart. If we add the character for taste or flavor, we have a whole new thing. Now, taste or flavor is really interesting from our culture. Taste in English comes from what touches our tongue, and that's the root of the language. But in Asian cultures, it's mouth, and you see that square, and the character not yet, a tree which isn't fully bloomed. So taste or flavor is not yet the mouth. It's what we see, it's what we hear, it's what we smell, it's the people we're with, it's the setting we're in, all determine taste or flavor. And if you've ever been on a cold, miserable day in the Boundary Waters, macaroni and cheese out of a box can be absolutely delicious. And that's what I mean by that. But if we combine these two, that is, if we can, that is meaning and taste or flavor, that is, if we can taste the meaning We have a whole new character, meaning significance. If we can taste the meaning, we understand the significance. And this is, again, Carl Rogers, and to kind of affirm the role of psychology in all this, is to hear the words, the thoughts, the feeling tones, the personal meaning, to hear that. Even the meaning is below the conscious intent of the speaker. In that deep human cry lies really the sounds of the heart, and that's where I want to connect. And we don't connect as experts, we don't connect as people with answers, we connect as fellow human beings with imperfections. So, last character, to care. Okay, you see on the right-hand side, we've got meaning, and the left-hand side is the character pronounced kai, which means to assist or to support. And kai is kind of interesting. Japan is full of puns. So kai also means to meet, as a meeting, and it also means right here, right now. So, right here, right now, to meet, to support meaning is to care. In this moment right now, supporting meaning, supporting the sounds of the heart is to care. And from caring comes courage. And that is our hope. So, I hope it's been provocative. I can cover all kinds of things. Our panel is here. We're looking forward to your questions because I want to address issues which are of practical importance, and that I want to make sure your questions are answered tonight. And I'm sure that I'm hoping that I've been provocative. So, thank you.
Thank you, Chair.
Thank you.
Hopefully, if you had some questions, you got to write them down. The question is for anyone that can chime in on this. Can you talk about cancer rehab and its role?
Well, I guess I can start. Cancer rehab in terms of post-operative rehab, perhaps, or post-therapy rehab. I'll go both ways. I work with surgical oncology patients at the University of Minnesota, and we frequently will discharge folks with physical therapy and occupational therapy in the home environment if they're not able to come into the clinic environment to gain strength and hopefully get back to baseline what their physical abilities were before they came to us for their surgical treatment. As far as the clinical setting with you're getting chemotherapy as an outpatient, and I think maybe, I bet you Catherine can speak to this, how we follow you in terms of helping you maintain your strength and things through treatment can be handled in an outpatient environment or a place just like this at the Cashman Center with the alternatives available. I don't know if that really answers the question.